Anna, you've been coming on for a while, and did you foresee the weakness in most of your stocks that we've seen, Humana and some of the others? Because I think almost every time you're on, you would say that there are these external things, but that these are well positioned to flourish in any environment in terms of whether there was Obamacare reform or whatever they're doing. And that clearly has not been what's happened with this.
Yeah. I think we've seen the movie before. I'm going to stick to my guns on this one. I think the fundamentals are actually very good, not just for the insurance industry, but importantly for American society. And they've done, a lot of positive things, which I actually support. And I've said this many times on, Medicare Advantage. It's the blueprint for how public-private partnerships should work. It's saving money for seniors. It's saving money for the government. Humana is a stock that I think on the theme of Medicare Advantage for all. I know, you might laugh, but it's going to play itself out. The question is when. I mean, clearly Warren is picking up a lot of ground, now with Sanders and the health issue, Biden and the Ukraine issue and all of that. And so you might have overhang persist if she wins the primary. I mean, the polls are beginning to show that. And if she does, then it persists into the general unless, she moves more center. But if the Senate is still Republican, nothing's going to happen. There might be a little bit more noise after November 2020, but, at that point, the stock should work. I guess I agree with you, though, that headline risk is going to be a key, element and a driver in how these stocks perform. You need a catalyst, and the catalyst is the election.
We try to, if we can, we try to avoid talking about, candidates, what's going to happen, but it's impossible in this arena right now. And you say from a stock market perspective, the performance of this sector is dependent on the event-ridden timeline leading up to the primary and going into the general election. Now, you do make the point that so many times we hear that, well, even if we did get Elizabeth Warren, she's not going to do all the things she says, or it's impossible to get those things done. Yeah. And you make that point, but you also make the point that if Trump were to win, it would be a huge positive for healthcare versus
stocks.
For healthcare stocks.
For stocks, it would be. For stocks, it would be. For the whole healthcare sector in general. More so, I'd say, the services side, managed care in particular, to some degree, the hospitals. Less so for biopharma. I mean, the drug pricing bill probably has made the most progress and has more bipartisan alignment than any other legislation we've seen so far in healthcare.
But even though if Elizabeth Warren did win the primary and did win the general election, you point out that the possibility of single-payer Medicare for all is still very small, but the overhang of having that possibility would hurt the stocks. Yeah,
through the general. I mean, if she actually wins the general election, but the Senate is, doesn't flip, then there's limited change that she can accomplish through the administration.
But in some sense, Anna, don't you also think we have seen a change? And I looked back, and in the September quarter of 2015, which is sort of in the same point where we are in the election, in that cycle, we had a huge downdraft throughout healthcare because of all of the rhetoric that we were hearing from both sides about reform. And this time it seems as though that has caught on in Washington, although right now with the impeachment distraction, some of that may be on hold. There is bipartisan support, and I wonder whether Trump or a Democrat wins, whether that is not going to move forward.
Bipartisan in terms of Medicare for all?
In terms of price reform and trying to really rein in costs. The Trump administration, CMS, has also been trying to also kind of home in on the hospitals as well to make them much more transparent about their costs, and also to try to sort of make more transparency about these deals that oftentimes end up working against the consumer because of the out-of-pocket costs.
No, all that is fair. I think it's a $3.8 trillion economy. You have Obamacare. They had 85% of the premium dollar going to medical spend. The entire health insurance industry does $50 billion in post-tax. It's like 1.5% of this almost $4 trillion economy. all of the costs, they reside truly, as you say, in the hospital economy. It's 50% of overall spend. And it's largely unit price driven. You know, it's not consumption. Consumption is moderated and slowed down to low to mid single digits. And unit price inflation is being attacked, if you will, on the drug side with drug pricing legislation. Actually, I think it's a pretty, it's a rational bill that the House has put out, and Senate Finance is largely aligned, and Trump is aligned for that matter. The hospital economy, they're finding legal loopholes, with the site-neutral payments, surprise billing. There's been a lot of entrenched interests and all of that, but eventually,
a lot of the surprise billing
that's
comes
where it'll
from
go.
Private equity firms owning a lot of those physician groups.
I mean, Team Health and Envision, and what happened with Blackstone and KKR and all that. But I think I'm bullish on the middlemen, PBMs and health insurers, because they don't make a lot of money. They've moderated spend. And I think, you should be buying CVS, Cigna, and United, because the PBM smear campaign by Biopharma has failed, if you will.